Our next speaker is going to be Dr. Beth Mynatt, who is the recently appointed Dean of the Corey College of Computer Sciences at Northeastern University. Dr. Mynatt?
Thank you, Brad. And I think this is going to pick up on some of the conversation and discussion that Sheila has started for us. So I have no disclosures to report with this talk, just the disclosure of how much work it is to completely change jobs. But it's an exciting time. And in particular, I'm going to be discussing more on the patient engagement side. So picking up from our conversations earlier today within the workshop. And all credit really goes to Professor Maya Jacobs, who's now at Northwestern University, because I'm pulling much from her dissertation work with me at Georgia Tech. So on the next slide, this work focuses on a key question of how do we create technology that encourages sustained patient engagement. And in the context of EHRs, we can think of this as how do we glean information out of the EHR to support prolonged, sustained patient engagement across the cancer journey, as well as how do we get that timely information, patient-reported outcomes, when they are away from clinic and not immediately under observation. So exactly some of the examples that Sheila was giving us. And what I will look to is that it's not only just the technology itself, but it's the network of relationships that the technology is contextualized into, which is going to have a strong effect on the success of our approach. So in the next slide, our work focused on creating support for a patient's cancer journey. And in particular, we were working with breast cancer patients in a rural context. So we were in rural Northwest Georgia, based in Rome. And the beginning of our work focused on understanding cancer navigation. Because if we could understand how human beings, these cancer navigators, were able to work with patients through all the twists and turns and disappointments and frustrations and excitement throughout the cancer treatment process, then we would be able to create technologies that would be able to support patients when they didn't have access to these very small number of individuals, especially as they lived many, many miles, would have to travel quite a distance for face-to-face interactions. And all of this was distilled into designing a mobile tool for breast cancer patients throughout their treatment journey. So on the next slide, just to contextualize this a bit, when we think of EHRs, it tends to be that first image, the notion of coordinated care surrounding a patient and coordination of information. However, when we talk to cancer patients and even cancer navigators, their system of information includes healthcare, but it's also related to job and work and childcare responsibilities and support by faith-based organizations and so on. So we were really looking at creating an information ecosystem that could surround and center on the patient as the way they saw their experience. So in the next slide, what we were able to do was to start working and expanding on a cancer journey framework that both looked at the healthcare responsibilities, treatments, and managing side effects, but also looked at the other personal and challenges within the cancer journey. And what we sought to do was to be able to look at supporting the patient engagement temporarily, so across the treatment path, but also across that breadth and that holistic experience. So on the next slide, what we did was create an overall approach that started first and foremost with that holistic patient-centered care. What were the numerous physical, practical, and emotional challenges that were kind of occurring in parallel? And by having this holistic perspective, we were creating a tool or an engagement that didn't just focus on the person as a patient per se, but allowed them to focus on all the other challenges that were adjacent or related to being under cancer treatment. Since this is an overwhelming experience, and it's certainly an overwhelming amount of information, it was important for us to create experiences with our tablet that were highly personalized. And in this case, we're drawing from EHR information about diagnosis, treatment plan, as well as other information about the patient, including the types of daily responsibilities that they would experience. And then finally, we wanted to make their interaction with the system adaptive to the extent that as they said what was going on with them, that we were then able to adjust that experience. And so this would be side effects, this would be depression, anxiety, difficulty talking to friends or family. So it was an extension of patient-reported outcomes that are traditionally used, but allowed us then to create that adaptive, personalized experience. The core features of our system was that we deployed a mobile device. If we were doing this again, we would just be deploying an app. Think of this as a kind of more adaptive, personalized patient portal. But we used it on an open, customizable platform so that patients could be interacting with our technology, whether they were focusing on cancer treatment that particular day. It was incredibly important that it was deployed and integrated into their experience with the health system. So this was not an app that they were just downloading in an app store, but it was something that was essentially prescribed, suggested to them by their healthcare providers. And our AI system is actually quite simple. It's just used to index vetted resources by their healthcare provider, by the American Cancer Society, but again, against their personalized diagnosis treatment plan, as well as their patient-reported outcomes. So on the next slide, you see that their experience from an interface point of view is the main page is they have the one-stop shop, again, that patient-centered care experience of information that can be about treatments, but it can also be social support, health and well-being, tips and suggestions, as well as just even suggestions for managing childcare or even social services. So access to financial resources, perhaps for transportation or other matters. And the bottom is the survey, which is the patient-reported outcomes that we suggested they complete weekly. Some did weekly, some did daily. That was, again, information, just even their engagement with the system. And then in the middle, what happens is this is all distilled down to personalized resources for them to make sense of their cancer experience. And so repeating after Sheila's comments, some of the things that they would read would help them understand side effects and be able to bring that to talk to their care team. Some of it would just also be recommendations for a healthy diet, for ways of approaching their life, meditation, mindfulness, and so on. So in the next slide, what you'll see is that this is pulling from the EHR as well as information that we would get from cancer navigators to create that personalized experience. We have the adaptive engine running based on the patient-reported outcomes, and then this is information that is flowing then back into the AHR system. And then we evaluated this using a number of common survey mechanisms as well as qualitative interviewing. So as I want to conclude, what I want us to focus on here is that on the next slide, that this has been an example of how do we create engagement with the system. And in particular, I focused on what does it mean for patients to be engaging this larger healthcare system, much of which, but not all of which, is dominated by the EHR. For our patients to provide useful information as well as to adhere or engage with the suggestions that were being provided to them, it was incredibly important that we create a holistic experience that recognized that cancer was just one of the many things that they had going on in their lives. But nevertheless, managing childcare, managing transportation, managing mental health was incredibly important to their sustained engagement and compliance with treatment. By using simple AI techniques, we were able to provide information and engagement with the patients that was relevant to them, was provided that longitudinal support, personalized and adaptive. And what I mean by longitudinal is our initial research with patients working with kind of the paper equivalent of this, or even the online equivalent, is there would be this information binging experience that would happen right upon diagnosis. But then they would tend to not pick up the information as needed. And by essentially bringing the information out over time during their treatment plan, they were way more likely to stay engaged. I want to close with some other recommendations that I think are relevant for our discussions today, both in terms of presenting information that supports their confidence engagement with their healthcare system, as well as information that allows us sorry, now I've even lost my own notes, um, allows us to help coordination. Part of what we were able to see with this is that patients would tell the system things that they would not tell their physician. So there's some of the information gaps that we can address in EHRs through these approaches. Thank you very much.
Thank you, Beth.